A big relief today for folks who take insulin.
One of the three most popular brands says it will go from charging almost $300 a vial to capping out-of-pocket prices at $35.
Now this will impact about 3 out of every 10 diabetics in America, the ones who use Eli Lilly brands.
Yeah, and it's for people with commercial insurance, and you'll need to call your pharmacy to make sure that they're actually part of this new price cap. If you don't have insurance, there's a discount card that you need to download.
The CEO says today is really about lowering the cost of older insulins. That's what people expect from our industry. We are doing this completely voluntarily because it's time and it's the right thing to do. Now this comes a couple of months after there was a lot of backlash against the company. It started in November when someone used Twitter's changing rules to fake an account that looked like the real Lilly, tweeting, "We are excited to announce insulin is free now." The real company responded, tweeting, "We apologize to those who've been served a misleading message from a fake Lilly account." And that set off a storm of backlash online, with messages from people like this who tweeted saying, "Hi, my brother died November 11th, 2019 from DKA because he couldn't afford insulin and was rationing it. I think you have more to apologize for than just a misleading message." It is worth noting, while $35 is a lot cheaper price, our Verified team found experts saying it costs the company anywhere between $10 to $25 to make each vial of insulin.
Well, Eli Lilly's price drop also comes after President Joe Biden signed a law in August called the Inflation Reduction Act, and that capped the cost of insulin for people on Medicare to that $35. It also provides several other kinds of financial help for folks on the program. But Russ Bowen learned the savings are going to take a while to kick in.
This is going to play out over a series of years. This isn't something that we can just turn around and start doing tomorrow. It takes some work to get implemented.
Medicare will now be able to negotiate with drug companies, but how long do you have to wait? For those on Medicare Part D, prices on 10 different drugs go into effect in 2026. It jumps to 15 drugs in 2027. And in 2028, Medicare Part B is phased in, and in 2029, the total jumps to 20 drugs. Melissa Burrows is with the healthcare advocacy organization Families USA.
This legislation is a huge step forward to making sure that prescription drugs are affordable in this country, especially for people who rely on Medicare for their health insurance. And for over 2 million North Carolinians who rely on Medicare for their health insurance, that's a really big deal.
It doesn't stop there. The elimination of the 5% co-insurance for catastrophic coverage goes away in 2024, and the limit on increases to your premium phases in 2024 as well. The $35 cap on insulin starts in 2023, and the $2,000 out-of-pocket cap starts in 2025. Burrows hopes that means that seniors can spend some of that money they will save on lifestyle choices to stay healthy.
You shouldn't have to be choosing between your life-saving medications and buying healthy food or your Y membership or your rent, having stable housing. All of those things affect your health. And so by not having to make those trade-offs, this goes a lot further than just prescription drugs.
For people not on Medicare struggling to pay for medications, Amazon has a new service where you could get some of the most common prescriptions for just $5 a month. Amazon's RX Pass is an add-on option to Amazon Prime. If you already pay $14.99 per month for Prime, you can pay an additional $5 to cover all of your eligible prescriptions. According to Amazon's website, RX Pass subscription includes more than 50 generic medicines covering many common conditions. That includes everything from allergies to breast cancer and mental health. The program does not cover insulin, but some other medicines for diabetics are included. A generic form of Viagra is also covered by the program. The website goes on, subscribers can get all their prescribed medication on the RX Pass list filled as often as they need for one flat monthly fee. RX Pass also works with auto refill so that you'll get all of your eligible prescriptions automatically for no more than $5 a month. Here's the catch. Folks on Medicare or Medicaid are not eligible for many medications that are not covered by the RX Pass program. You can still get a discount with your Prime account through Amazon Pharmacy. And Amazon says you can cancel RX Pass anytime.
Now, if you can't find what you need online, don't forget to check out the pharmacies at Sam's Club and Costco. That's right, you can still use their pharmacies. You don't need a membership to get your medicine from Costco or Sam's. Also, ask your pharmacist if your medication is cheaper with or without insurance. For a variety of reasons, it might actually be cheaper without it, depending on the pharmacy.
With the average American spending over $1,200 a year on medicine, we are always looking for ways to save.
That's right. And if you have another trick or concern about a particular medicine, you know what? Let us know. Text us your thoughts. You can reach us at 336-379-5775. All you do is text the word DIG, D-I-G, to that number right there.